Hey guys, my name is Jesse. I have a little bit of a problem with my friend Sully. Sully wants to become a physician assistant but believes that learning medical terminology is not really important and he thinks that he could just go by just memorizing words. Well, I think it's really important to know your medical terminologies and learning how to read it. So with this video, it's basically a crash course on how to actually read medical terminologies, how to break them down and build them together. With that being said, let's just start with the basics, which are the word parts. So let's get on with that. So again, let's start with the basics, which are the type of word parts. We first have the root, which is the foundation of the term. Then we have a combining vowel, which is usually an O, and this part is used to link root words to suffixes or another root. When we have a root and a combining vowel together, we get the combining form. Here are some examples of combining form. We have glyco, which means sugar. We have arthro, which means joint, and then we have myo, which means muscle. As you can see, all these terms have a root and a combining vowel. Next we have is a suffix, which is the word ending. One thing to point out is that all medical terminology have a suffix. Here are some examples of suffixes. We have emia. Notice that there's a hyphen in front of the word. This indicates that it's a suffix. We have emia, which is a blood condition. Itis, which is an inflammation. And the last one is pathy, which means disease condition. And lastly, we have a prefix, which is a small part attached to the beginning of a word. A little side note is that not all medical terminologies have a prefix. Some examples of prefixes are hyper. Notice that there's a hyphen at the end, which means excessive, endo, which means within, and retro, which means behind. Now you may be asking how all these word parts work together. Well, let's build a word together. So an easy way to remember where each part go is to remember P-R-S. Prefix will be found in the beginning of the word. Remember, not all medical terminology will have a prefix. Following a prefix is a root, and following that can be another root or a suffix. And remember, all medical terminologies will end with a suffix. And if a suffix begins with a vowel, you will need to drop that combining vowel. So here's an example. Let's build a term that means inflammation of the joints. So we know that erythro is the combining form that means joints, and the suffix itis means inflammation. Note that the suffix has a vowel at the beginning, so you would drop the combining vowel in arthro. So if you put that word together, we get the term arthritis, which is the medical term for inflammation of a joint. Let's try another one, but with the prefix. What would be the term that is defined as having excessive levels of sugar in the bloodstream? To start off, we should know that the term glyco means sugar. And the suffix we would use is emia, which is blood condition, since we're dealing with the blood. And lastly, we would use the prefix hyper, which means excessive. Altogether, we should get the term hyperglycemia, which is the medical term for having high sugar levels in the bloodstream. Now let us try one that has two root words and a suffix. So let's build a term that means disease of heart muscle. As we know that cardio means heart, and myo means muscle, and pathy means disease. When we combine all of these word parts, we would get the word cardiomyopathy. Now that we know how to build medical terminology, let's look at how to break them apart and find their meanings. Again, we should remember that most medical terminology will follow the pattern of prefix, root, then suffix, P-R-S. When breaking down words, we should start backwards, starting with the suffix. With that in mind, let's break down the word neuralgia. So the suffix for this word is algia, which means pain, and the root for this word is neuro, which means nerve. With that being said, neuralgia means nerve pain. Let's try another word. Here we have the word retrocardiac. As you can see, we have a suffix "ac", which means pertaining to. We also have the root word cardio, which means heart, and lastly we have the prefix retro, which means behind. So altogether, retrocardiac means pertaining to behind the heart. Let's try a trickier one. Here we have the word electroencephalogram. As you can tell, the suffix for this word is gram, which means record. And lastly, this word has two roots, electro, which means electricity, and encephalo, which means brain. Altogether, the meaning of the electroencephalogram is a record of the electricity in the brain. This is how you break down most medical terms, which seems easy. Since we now know the basis of medical terminology and know how to build and break down words, let's go back to the suffixes. As I said earlier, all medical terminologies have suffixes, but sometimes suffixes can look the same, but to have different meaning. For example, we have the words site and cytosis. These two suffixes look similar but really have different meanings, where site means cell, whereas cytosis means increase in cells. And these similar looking suffixes can also be seen in a few others. For example, gram, graph, and graphy, scope and scopy, tomy, ectomy, and stomy. And we'll go over each one next, starting with gram, graph, and graphy. So let's first look at gram, graph, and graphy. Each one looks similar but are really different. So gram means record, graph means instrument for recording, and graphy means the process of recording. For example, we have these three terms that all have the suffixes: electrocardiogram, electrocardiograph, and electrocardiography. Electrocardiogram is a record of the electricity within the heart. Electrocardiograph is the instrument used to record the electricity within the heart, and electrocardiography is the process of recording the electricity within a heart. All of these are pretty much the same thing, but they all have different meanings. Next, we have scope and scopy. Scope means an instrument for visual examination, whereas scopy is the process of visually examining. So for example of these two being used, we have the word ophthalmoscope, which is an instrument to visually examine the eyes, and ophthalmoscopy, which is the process of visually examining the interior of the eye. Our last set of similar sounding suffixes are tomy, ectomy, and stomy. Similar to the last two, these are similar looking but all have different meanings. Stomy means the process of cutting, ectomy means removal, and stomy means opening to form a mouth. Here are some examples of each suffix being used. Gastrotomy, incision of the stomach. Gastrectomy is a removal or excision of the stomach. And gastomy, which is the new opening of the stomach through the abdominal wall to the outside of the body. Well, that's the end of the video. Thank you guys for watching. I hope this helps you understand more of what medical terminology is all about. I hope this helps Sully decide to actually learn medical terminology for his path for physician assistant. But thank you again for watching. Hope this helps. Peace.